Okay, start recording. Yeah. Okay, welcome to our second DSML seminar. No doubt, now AI has started a revolution. The impact of AI on our everyday life and every aspect is there, is here to stay. So one major impact is about job replacement. In the past, any technology may replace lower level skill, but today, well, it's new, it's different. AI tend to replace professional. You know, long time ago, well, not time ago, actually for a long time, it take multimedia expert to create video, audiovisual material, to edit a YouTube movie and so on. But today you can just use a prompt to ask AI to create video, to create photorealistic image, which means many traditional multimedia designer, video production team may be gone, okay, or will receive fewer and fewer assignment. So job displacement is real. The question is, can AI really replace doctors, physicians, and so on? And today we are so glad that we have an expert on this field. And Dr. Wong, he's a triple D, PhD, MD, and also JD. And he understands multifaceted, multiple aspects of the subject matter, the scientific aspect, the social aspect, the legal aspect. And the topic is about, can AI replace physician? Now, okay, I will hand over the seminar to Dr. Wong. Okay.
Thank you, Dr. Yu, for inviting me to this presentation. And aloha and happy Mid-Autumn Festival. I know there's still noontime in Hawaii, but I'm in the East Coast right now. So after the seminar, I'll go out and fully see the moon. Although you may think that I'm sitting on top of Diamond Head and giving this presentation, but that's just the picture. Okay. Anyway, so Dr. Yu has asked me to share with you my personal feeling on whether AI can replace physicians. Now, first, let me give you a disclaimer. What I'm going to say today is strictly my personal opinion. Although I did some research on the topics, it is by no means any formal by no means a conclusion from any formal large-scale scientific study. So take it with 2 grains of salt. So I think that in the past 2 years, you were strangled on an island, not knowing what's going on in the rest of the world. But obviously, you've missed a big party, an AI coming out party. And since 2013, 2013, suddenly we got this proliferation of AI systems. So we got ChatGPT that came out in November 2022, and then we got Google, Facebook, Meta, we got Microsoft Copilot, and then we got Apple that all suddenly coming out. So unless you were on an island during the last 2 years, it's impossible that you have not heard of something about AI and what it may do to our society. Now, it's not only on the software side, we see the same kind of change in the hardware market. So if you have bought some stock in Nvidia in past 5 years ago, you'll be rich. Maybe you won't be sitting here listening to me. Another company, Supermicro, same thing, although recently it just pulled back a little bit, still a very good 3,000% return in 5 years. And at the time, it was almost 6,000% return. So AI is here to stay no matter whether you're in the hardware field or in the software field. And as Dr. Yu said, the consensus or these experts are predicting that AI will replace a lot of jobs. McKinsey, which is a very famous consulting firm, said that by 2030, which is not far, only 6 years from now, the US economy, a lot of the jobs will be gone. And Goldman Sachs also predict that 1/4 of the current jobs will be replaced by AI. 1/4. That's very scary. But the good news is that, well, not good news. It said that the jobs in the US and Japan and so on are more at risk, while those in China and India would be safer. So, what is it going to do to us? Now, I'm in the healthcare field. Even though Dr. Lee said that I've been trained in different areas, I consider myself a physician, number one. And then my informatics side and my legal side are sort of like helping me to do my job as a physician. So I was first trained in informatics, in information systems before medical school. Anyway, so this is the $64 million question. Can AI replace physicians? Or can AI replace many jobs in the healthcare industry? And I'm going to share my 2 cents with you. Now, actually, AI and medicine has a very long history. It's an article a few years ago that talks about the different milestones of AI in healthcare. And there are a lot of events of AI getting into healthcare. I'm only going to highlight 2 events that are most familiar to the non-clinical people. The first major milestone in AI in healthcare is 1975. The mycin system. Edward Shortlight, he got his PhD in computer science from Stanford, and his dissertation was on a system called mycin. An express system is the backwards chaining express system that was able to do diagnosis and treatment recommendations for certain infectious disease. So it was able to identify what bacteria and recommend the appropriate antibiotic. That was considered to be the first system that can actually perform at the level of an expert. Now, it's a short life. Also received an MD from Stanford 1 year later. So, like me, he was first trained in the information technology area and then moved on to medicine. So he's really one of my heroes. And he had a very successful career in medical informatics and medicine. Although he retired a few years ago. Since mycin, we had a lot of similar systems. Okay, in oncology and in different areas. Now, these systems were all successful in terms of demonstrating that you can use expert system to mimic the performance of an expert. So they were able to function as good as an expert. They were never really in production. They were not put in production because of many issues. Sometimes the interface design, the system limitations, and so on were the major obstacles for getting them into production. Also, we didn't have any good business model. You have to keep these systems updated with all the new developments, and no one could figure out a way to make money from these systems. So they were all just developed as an academic exercise and put into production. The second milestone in AI for healthcare is IBM Watson. Many of you may remember this. In 2011, which was only like 13 years ago, IBM developed its expert system or its computer called Watson. And Watson played Jeopardy and beat 2 champions. So it was like a very big news in the media. And a computer can beat 2 human experts. The uniqueness of Watson is that it is a natural language processing system. So it can understand human languages and give answers in human languages. Unlike my thing, which still require like certain level of computer expertise to use it. Watson, anyone can talk to Watson, and Watson will give you an answer in the way that you understand. Now, since Watson was introduced, IBM tried to commercialize it. So they formed a division called Watson Health. They tried to partner with various companies to do the to commercialize the product, including they try to partner with Anthem, with MD Edison, with Memorial Catering. They try to use this expert system or this AI system to figure out the best way to treat certain disease and to do certain things. Unfortunately, even with IBM, with all those major academic medical centers, and with a major insurance company, with all the data in Anthem, there was no success to report. I tried to do a literature review on whether there's any paper that came out from Watson. None. I couldn't find any. And 2 years ago, IBM even sold Watson to a private equity firm. It was not making money at all. And it was not put into use in any of those academic centers. So, like, the question then is, why? Well, I got an answer. Although I don't think you will buy it, but my answer is that when IBM signed the contract with Anthem, I already left Anthem. I was the medical director for Anthem for national for clinical informatics, but I left Anthem in 2010, and Watson was after I left. Now, of course, that's just killing. I don't think I could make any difference. So, what exactly is the Achilles skill in using AI in medicine? I'm trying to give you an answer, at least give you my version of it and see if it makes sense. Also directly related to the question we're trying to answer, whether AI can replace physician. But before we dive into it, I want to go back and ask the question. So what exactly does AI do in healthcare or in clinical medicine? What exactly does it do? Going back to Dr. Shortlight's one of his very early paper, he mentioned that he suggests that there are actually 3 areas in using information technology. And I said information technology, not necessarily AI. AI is one kind of information technology. This is a subset of information technology. So let me try to be clear in that. But when we use information technology in general in medicine, in clinical medicine, there are really 3 areas that we try to use it. We use it in signal processing, in data processing, and in knowledge processing. So let me try to explain what exactly do I mean by signal processing, data processing, and knowledge processing, and what are the roles of AI in those areas. In signal processing, what we're trying to do, oh, I'm sorry, I hope that I didn't somehow mess up my screen. Let me see. Yeah, okay. So in signal processing, what we're trying to do is we're trying to convert our medical signal or a biochemical signal into a human understandable format. Now, our body is full of chemical signals. It reflects how we are doing. So some of those things are things that you see every day, like the EKG machine. The EKG machine does is actually converting electrical signals that it can detect in our heart into some kind of graphs that we can understand. And using those graphs, we can tell the condition of the heart, whether we're having a heart attack, some blockage in the arteries, or some irregular heartbeat, and so on. And Nowadays, most EKG machines actually can give you a diagnosis. That's using AI technology. So AI is reading the EKG and trying to tell you what's wrong with the heart. Many of you also have seen this pulse ox this pulse ox device. So you put a finger in, it tells you whether you're getting enough oxygen. Again, this converting a biochemical signal, it actually uses a laser to go into your blood vessel to measure the amount of oxygen in your blood, and they give you a reader to tell you whether you're healthy or not. Or the continuous glucose monitoring device that monitors your blood sugar level for those with diabetes. So that's what signal processing is doing. Now, AI has been doing signal processing for about 20 years, mainly in radiology and in pathology, in reading X-rays and in reading many of those cytology slides or those things that goes through and auto-analyze. So, for example, you do cervical cancer screening, you do a pap smear on ladies. It used to be that a tech will look under the microscope to see if he or she can see any abnormal things. We found out that AI can do that much better. Same for radiology. Now you can use AI to read chest X-rays to see if you or to read mammograms. I think it's the more common use of AI in reading X-rays, just in reading mammograms. So one study, both 5-6 years ago, find that in terms of reading the pap smear cells, AI has better specificity than a human technician. The sensitivity is it has better sensitivity and the specificity is the same. In case you're not familiar with sensitivity or specificity, so how those reflect the accuracy of a test. Sensitivity means if you actually have cancer, what is the chance that the test can tell you that you have cancer? So you want sensitivity to be as high as possible. You don't want to miss it. Specificity is if you have cancer, what's the chance that the system will tell you that you don't have cancer? You don't want any false positives. We don't want to scare you to death if you don't have cancer. Because if the system says that you may have cancer, we have to do a lot of testing and diagnosis and so on. That's expensive, that's invasive, and that's bad for the patient. So we want high sensitivity and high specificity. And in this area, AI is doing better than human. And we've been doing that for years. Now, in the future, what can AI do? I think that the holy grail in signal processing in using AI is to do robot surgery. Now, you've heard of robot surgery, but actually the so-called robot surgery today, they're not robot surgery. They're robot-assisted surgery. It's still a surgeon, the Da Vinci device. That's one of the most popular robot surgery device. It's a two-phase machine, but it's still operated by a surgeon. The surgeon controls how this robot operates on the patient. So it's not robotic surgery. It's robot-assisted surgery. It's still the surgeon doing the procedure. In true robot operating surgery, maybe you have the MRI trying to figure out what's wrong with the patient. You know where's the tumor or when to operate, and then you program that into a robot. The robot will do everything without any human intervention. We're not there yet, but that's the direction that we may be going. Another direction that we may be going is artificial organs. So if like insulin pump is a simple example. So you have the blood sugar controlling device, and you can have a feedback loop. You feed the reading into the pump. The pump will pump insulin into your body to regulate the amount of blood sugar in blood. Insulin is and blood sugar is relatively easy. We have much more complicated systems like our liver, our kidney, and so on. And hopefully one day we can have artificial devices that can control those the function of those organs. It's the first area of using information technology in clinical situation. And AI, again, as I mentioned, is part of the clinical or the information technology. The second area that we use informatics in clinical setting is data processing. Now, many of you are familiar with traditional data processing. We have a lot of transaction systems in healthcare, but usually not directly related to patient care, but it's still a critical part of the system, like practice management, the electronic medical record, the billing and claims, electronic prescriptions. For insurance companies, the utilization management system, and so on. And a lot of time we're doing data mining, and Dr. Yu is really the expert in data mining, so he can give you much more detailed information in that. But usually right now, when we do data mining, we focus on doing performance reporting. We want to find out whether a clinician is doing a good job. And we also use it to calculate clinical outcomes. For example, in a drug trial, you want to find out what works and what doesn't work. With a large number of patients, especially the post-authorization trial, this is stage 4 FDA trial, there's very large data set, and you may need you may need AI to help you sort out the clinical outcomes. Traditional statistics may not work because in the post-market trial, it is no longer a clean randomized control study. Now, what AI can do? I think AI in this case can do several things in data mining. It will be very powerful in doing an early warning system to pick out emerging diseases like COVID. So it takes about maybe 2 to 3 months to realize that something really is going on. But fully with a good data mining system, we can pick up those cases like even earlier. And that will give us some heads up in terms of developing machines or getting prepared. We can also use it to do a barren case identifications, whether someone is trying to game the system or trying to do something that's not acceptable. The FDA is using more and more this to monitor check prescription. Whether some doctors are also prescribing some controlled substance. And fraud and abuse, again, it used to be it's very difficult to pick out fraud and abuse cases. Now it's pretty straightforward. AI can do a lot in terms of improving data mining. But in the third area, knowledge processing, that's the area we're referring to in terms of diagnosis and treatment. And the big question is, are we there yet? Can AI be perfect to do diagnosis and treatment? That really is the holy grail in using AI to do diagnosis, in using AI in healthcare or in medicine, i.e., to have AI correctly diagnose, especially those rare diseases, and make recommendations on how to treat them. Are we there yet? Let's look at some reports and some data again. So once ChatGPT was introduced, we'll try to see, hey, can it take the exams just like medical students? Now, if you're in medical school or you have friends in medical school, you know that they have to take a ton of exams, and we all have to pass the USMLE exam in order to be licensed in any states. So let's say 3 steps exam. Step 1, you take it between medical school year 2 and medical step year 3. In step 2, you take between year 3 and year 4, and step 3, you take 1 year after graduation. In 2023, they try having ChatGPT take the exam, and ChatGPT pass it with a score of roughly 60%. That is the minimum requirement to pass. So ChatGPT was doing about the same as a sort of like the low average for passing medical student. We saw this claim of significant improvement. Shortly after, Google system, the Medtel M2 scored 86%. Now, Medtel M2 and the open evidence AI systems specially designed for medicine. So those are not ChatGPT. ChatGPT is a general purpose AI system. They score roughly 9%. ChatGPT 4 also claimed to score roughly 90%. So that's very good, right? If you're a medical student, you score 9% in USMLE Spec 1, you're likely in the top 10 percentile of all medical students. So AI seems to be doing pretty good. And if you look at this graph, in 2 years, AI went from like the early 33% to ChatGPT 4, which is 60%. So that was in 2022. Prior to that, we had a whole bunch of failures. Well, not failure, but like low scores. And then up to the almost 90% in just 2 years. It's pretty good, right? I try to put it through some real life cases. Being able to pass exams is very different than being able to perform in real life. We all know that. Passing exam is only one component of being a doctor. So last month in August, during a 2-day span, that's in preparation for this talk, I tested Copilot and Meta AI with 6 cases on different diagnoses. All those 6 cases are real life cases. Either I have personally treated the patient or I know the patient. So some patients are my friends and some are my patients that I treat them. So how's AI doing? I'm gonna run through those cases pretty fast because I don't wanna overwhelm you if you're not a doctor. But the first case, I got a 40-year-old male in southern China who complains of tinnitus, which is ringing in 1 year. So I asked Copilot and Meta AI. Meta AI is Facebook. Copilot is Microsoft. So what do you think? They both gave me the same suggestions. Maybe hearing loss, infection, medications, Meniere's disease, which is a nerve disease in the ear, or some other things like hypertension, diabetes, thyroid problem, and so on. However, they both missed a very important and very critical diagnosis, nasopharyngeal cancer. Why is this like a big miss? Because specifically that southern China and tinnitus ringing in the ear. Ringing in the ear is a classic early presentation of nasopharyngeal cancer, also southern China. This map shows the prevalence of nasopharyngeal cancer in the world. So you see that there are not much cases in the US, but in China, part of Southeast Asia, and a little bit part of Africa, we see a lot of cases. So those AI systems apparently missed this clue. Now you may say that, okay, what's the big deal? The big deal is that this case is also a medical student must know cases because this is the first case, first solid proof that links a virus to a cancer. So if you go to medical school, in your physiology and in your pathology classes, you have to learn about this virus and this cancer. It's like knowing Newton discover gravitation. You cannot study physics and not know Newton discovered gravitation. Same thing, you cannot go to medical school and not knowing that nasopharyngeal cancer is caused by the Epstein-Barr virus and it is related to genetics in certain population group. Okay, case 2, let me be quick. This is my own patient. A patient went to Las Vegas for vacation, came back with low-grade fever, cough for 2 weeks. Still visiting Vegas. The pilot told me that it can be a respiratory infection, bacteria or virus, COVID, energy, and so on. The AI gave me the same things. plus valley fever and asthma. The correct answer is valley fever. So Copilot got it right. The Meta AI got it right. Copilot just missed it. And valley fever is a fungal infection in the southwestern part of the US. The third case, again, my patient got a 30-year-old lady complaining of hair loss, chronic fatigue. Now her thyroid hormone is normal, her thyroid hormone is normal, the hemoglobin is 46, hematocrit is 16. Both systems told me that she may have iron deficiency, anemia, some kind of vitamin deficiency, chronic disease, chronic kidney disease, and so on. But cannot be iron deficiency anemia because the hemoglobin and hematocrit are on the high side, not on the low side. So no medical student will give that recommendation. If I were rounding with medical students or residents in a hospital and they gave me some answer, I'll chew them up. Hemoglobin 46 and hematocrit 16 is high for a lady, not low. The true diagnosis is hemochromatosis, which is too much iron, not too few iron. Both systems missed it totally. Case 4, a 60-year-old African Korean immigrant complained of abdominal pain and so on after he got an injection in the knee for knee pain. So pilot gave me possible answers of medication side effects, liver issues, blah, blah, blah. Meta AI is very similar, except that it also adds reactivation of hepatitis B. And that's the correct answer. So Meta AI got the answer right, Copilot missed it. This case, this is my friend, hepatitis B carrier. The blood found high calcium and high alphos, which is a liver enzyme. Both gave me possible answers of liver disease, bone disorder, some hormonal disorder, some kind of cancer. Very similar answers. The correct answer is a kind of bone disease called Paget's disease. Neither were able to specifically tell me Paget's disease, but both were sort of correct in saying it's some kind of bone disease. The last case is a Japanese male complaining of chronic stomach pain after eating. Both systems tells me about some kind of stomach disease, but they also both miss the diagnosis, which is stomach cancer. And the key is Japanese. The number one cancer in Japan is stomach cancer. And since Hawaii has a very large ethnic Japanese population, stomach cancer is also a major cancer in Hawaii. Anyway, so this is a summary of how these two AI systems perform. You see that Copilot was a total failure. Meta AI was 2 out of 6. And then it was sort of like in the right track in 2 other, completely missed. The NT3 miss is really I think critical. So the conclusion is for the commercially available general purpose AI systems, it cannot be trusted yet. It cannot be trusted to come up with a correct differential diagnosis. They're not ready for prime time. Wow. That is the Achilles heel in medical informatics. Why are they giving this top performance in the test cases? So I try to dig a little bit deeper into what exactly the system's thinking. So I went back to my first case, the nasopharyngeal cancer case. So the 3 keywords, if you're taking the USMLE exam, you would pick up first in China, tinnitus, 1 year. If it's both years, then you know there's a likely different kind of nerve disease or ear disease because cancer is asymptomatic. 1 year, then you worry more about cancer or some kind of blockage. Now, if you look at the reason that Copilot is giving, tinnitus in 1 year, blah, 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 just of in China. So it seems that it's totally no one clue that I'm giving it. And I try to give you more clue by adding a neck mask. Okay, and a neck mask, any doctor see a neck mask will have a knee-jerk reaction that it could be some kind of cancer. We got to act fast. Now, it talks about cancer. It still doesn't really talk about cancer. It's still more southern China. So it is just not picking up the truth that I'm trying to give them. Why? Well, we've got a term called AI bias or machine learning bias. Again, I'll let Dr. Yu go into details to explain this AI bias. But according to IBM, there's three kinds of AI bias. The training data bias, the algorithm bias, and the prediction bias. So the problem could be with the training data, with the algorithm, or with the prediction. In my nasopharyngeal cancer case, this cancer is rarely seen in the US, and most clinicians, even the ENT specialists, may have never seen a case. Although they studied in medical school, they've never seen a case, so they forget. So in terms of, and we don't have that many training data in our system. You look at the training case, the data, it has very few cases, and a lot of the AI algorithm is really based on statistics. So NPC can keep up because maybe there are very, very few cases and it's just being washed out by the more common things. The algorithm bias, maybe we don't have that many people from that part of the world. So that's an algorithm bias. The algorithm, I don't know why, they've been trained to look at the background of the patient. That is a big no-no to me. Because in medical school, we're always trained to look at the background of the patient. Female and males are very different. Patients and African American are very different. Asians and Caucasians are very different. We have different genetics, so we have different prevalence in diseases. So those are things that we are trained to do in a knee-jerk fashion, but I don't know why those two AI systems are not trained to do that. And prediction bias is a result of training bias or algorithm bias. If there's bias in the data, there's bias in the algorithm, of course, your prediction is biased. So basically, those bias shakes the foundation of AI in medicine. We want to use AI in diagnosis is because we want to use AI to pick up those rare or non-classic cases. We want AI to find the needle in the haystack. Unfortunately, that's what exactly AI cannot do or not doing. AI may be able to give us the standard answers to common questions, but it is not doing what is most useful. Identify the rare cases that we need to identify. So if I were a Southern, or I am from Southern China, I'm a Hong Konger, if I have bringing in 1 year and I try to ask AI, I would totally miss the early detection of the nasopharyngeal cancer. That's bad. Or if I were Japanese and I got this stomach problem, this stomach discomfort, and I asked AI, it would totally miss the recommendation that I go to an endoscopy and miss the skin cancer. I may spend another several months trying to work out the other things, which I should do an endoscopy right away. Because in Japan, they do endoscopy on all adults 40 years. I think it's every 2 years or every 3 years as well. But if I were Japanese, and I haven't had a endoscopy, I should get one done, especially first generation. So in the two bias, the data bias and the algorithm bias are things that we can fix. We can write better programs. We can tell the system, hey, you got to look at, I don't know why Copilot and Meta AI and Meta are not doing it. but they're not doing it. But we can tell them to do this. However, training bias, we really don't have an answer to that. Simple example, back in 2019, around Christmas, you saw a lot of abnormal pneumonia, bacteria cases. You don't know what's going on. You can't find the bacteria. You can't find a virus. So you ask AI. AI will not be able to tell you anything because there's no data in any system that talks about COVID. So AI only works when a knowledge base exists. In the COVID example, at most AI could tell you is that, hey, this pneumonia may be caused by some kind of unknown agent. It could tell you, okay, you need to do some research. And you should do A, B, C, D, E, F, G to start your research, but that's it. It will not be able to give you anything more useful. And in terms of vaccine development, at that time, AI will not tell you, hey, go try mRNA. It will tell you that maybe you should, I think, do your protein-based and do your attenuated virus-based vaccines, but it will not tell you that, hey, mRNA is really an approach because we have no data. So this bias will always exist in clinical medicine. And that's why really Watson Health failed. Not because I left Entham, but because in Watson Health, it does not add much value to standard treatments in common diseases. So if I want to find out how to treat a patient with stage 3 triple negative breast cancer, don't need AI. You can do a Google and it'll give me the same answer. I would say average oncology know the answer immediately from the head. Yet, if you have a disease without a standard diagnosis or standard treatment program, like some kind of rare cancer, AI will not be able to help you because it doesn't have any data to help you. So that's why Watson Health failed, in my opinion. Now, let's talk about, can AI replace physicians? And what's the difference between AI and physicians? So I don't know whether you've heard of this Professor Umichi. I hope I pronounced his name correctly. He's a Japanese management expert, and he said something I think very helpful in our discussion. That's how he distinguished between professionals and specialists. He said that a professional is someone who's good at solving problems in a particular discipline. And a specialist is someone who's very good at doing certain classes. Most of the time, we associate professionals with specialists. We use the term often interchangeably. And really, there's a difference. So one is discipline-oriented and the other is task-oriented. So what does this have to do with medicine or doctors, physicians? The profession of medicine is to heal. So a physician's profession is to heal disease. But that itself is a moving target. So the problems we see as physicians today are very different than disease doctors saw 50 years ago. 50 years ago, when I was a child, like doctors didn't see much diabetes or hyperlipidemia or COPD because people die young. 60 was an old age. Fortunately, I am already over 60. So, and I hope that I'm still young at heart and I still consider like young. And nowadays, old is defined as 80s. But 50 years ago, 60 was old. I still remember my image of my grandfather was an old man walking with his cane. He was only 50 something when I was a child. And he died in his early 60s. So the profession itself is changing. Any physician must keep changing in order to stay in the profession. We cannot do what we are doing today in 10, 15 years and still claim to be a professional. And as a professional, we use intuition, i.e., our gut feeling, as much as we use our rational decision-making process. And very often, paradigm shifts in medicine are based on intuitions, not rational decision-making analysis. Two examples are Dr. Marshall, who discovered the H. pylori bacteria that cause ulcer and eventually leads to stomach cancer, and Dr. Carito, which invented the mRNA. So you all have read the story of Dr. Carito and what happened to her when she worked on mRNA. She was demoted because her superior thought that this was not something useful, so nobody listened to her. But her feeling said that, hey, this is something useful. So she kept working on it and she saved the world and she got her Nobel Prize, etc. Now, however, once you have more data and things become more organized, then eventually the profession, many of these things we do turns from intuition into more evidence-based, which is algorithm-oriented. So as more and more data become available, we are more and more evidence-based. So if you ask us how to treat diabetes, because we know so much about diabetes, we can be data-oriented, we can be evidence-based. Excuse me. And that is the difference between AI and physician. In medicine, we see these practice scope changes. As more and more knowledge becomes available on how to treat certain diseases, the practice scope change. The process becomes more data-driven and less intuitive. When I was a medical student, we got cardiologists doing heart failure and arrhythmia. That's the regular heartbeat. And like I do primary care. I do primary internal medicine. So were diseases that internal medicine, primary care, internal medicine wouldn't touch. We just refer back to the cardiologists. But nowadays, those are fair and square within our jurisdiction or our practice of managing patients with stable heart failure and arrhythmia. And cardiologists move on to some other more severe diseases. So a physician must first be a professional in doing healing, in figuring out how to heal people. And we may also be an expert, a specialist in certain things. So like right now, I consider myself a specialist in doing some things like cancer screening and maybe doing asthma and COPD and diabetes and so on. But those are things I know how to do right now. In 10 years, if I don't keep up, I may be totally outdated. And that is the difference between AI and profession. AI can be an excellent clinical specialist, but a poor professional. That is, if you can eliminate all the biases in AI, if you can eliminate the algorithm bias and the prediction bias. So once we have a lot of data, AI can treat certain conditions that are well established, like today's diabetes or some asthma and hyperpressure and so on. We always will have new diseases and we always will have new treatment protocols. Like how we treat diabetes today is very different from what we treat diabetes when I was in medical school. When I was in medical school, we got metformin, which is still used today. We got some TCTs, which are now like we hardly use now. We have the GLP-1, those are the injections, the weight loss injections, and we have some SGLT2 medications which were not available when I was a medical student. So the diseases change over time, the treatment changes over time. So it's only when you have standards, when you have protocols, that AI can be useful. So the conclusion is that AI cannot replace professionals. AI can replace specialists. We as professionals will not be replaced by AI, but the diseases and the things we do will keep changing. And we have to keep changing. We have to keep evolving in what we do in terms of keeping up with the development. But if you're a nurse practitioner or a physician assistant, and your job is very algorithm-based or data-driven, then those jobs may be replaced by AI. And this is very similar today. Nowadays, we have mid-level providers doing things that are well-defined. So the stable hypertension, the stable diabetes, the stable hyperlipidemia, you can say nurse practitioner. And they can do as good a job as a physician. But if you have any rare disease or unstable case without like clear guideline on how to do, then an algorithm-based treatment approach will not work. Another often discussed criteria in AI in medicine is some people claim that AI cannot replace doctors because AI don't have empathy. You cannot program empathy into a computer. Now, whether it's true or not, there's some debate on the tuning test on whether AI can mimic, right, can behave like a human that they fully use. Functionally, I don't see this as a major issue. I think this is a minor issue because we're more and more used to dealing with machines. So you go to McDonald's now, you interact with a machine. You go to many places, you interact with a machine. You go to a bank, you interact with a machine. And there's certain tasks that actually people may feel more comfortable interacting with a machine than interacting with humans. Like if you want to do an STD screening, maybe you want to an AI system instead of talking to real people because that's less embarrassing. Or there are some things that you just don't want or not convenient talking to an AI. So I don't see empathy as a major issue in AI in medicine because something that people often talk about, and I just like mentioned. Finally, I have 5 more minutes, so I'm gonna just use another profession as an example. Some of you have seen this before. Well, when I first went to college, so as Dr. Yu mentioned, my first college degree was in management. This is what I used in my introduction to accounting class. And how many of you seen this before? An Apple IIe computer with a program called Discipline. Hey,
Yes.
Alex, I know your age. You know my age. So we both have seen this before. Now, VisiCalc is actually the very first spreadsheet. That's the first electronic spreadsheet that saves the work of an accountant 70 to 80% of time when it was first introduced. It was first introduced in 1979. And many people argue that without VisiCalc, Apple Inc. would not be the Apple today because it is this program that made Apple really useful from a toy into a tool. So, and it's from VisiCalc, we got a package that Lotus 123. Now, again, many of you have not heard of it, but Lotus 123 was the second generation spreadsheet that replaced VisiCalc. And then nowadays, everybody uses Excel. Excel replaced Lotus 123. Excel and Lotus 123 actually overlapped for several years. And then Excel is more a marketing success than a technology success. They work very similarly, but the way that Microsoft markets Excel is to bundle with Office. The Office professional, the Office just make it right. They just capture the entire market. So electronic spreadsheet. What electronic spreadsheet does is it replaces the work of not replace. it reduced the time that an accountant has to use in terms of preparing financial statements by 70 to 80%. Has accountants disappeared? No. Accountant has not disappeared. This is the prediction in terms of the growth in the accounting industry, the growth in the number of professional accountants. What has changed is the job and the function of an accountant. It changed from people that are merely adding up numbers into people that are thinking about how to run a business. Now, whether that's good or bad, that's debatable. Some people argue that you have all those financial engineers, you have all those kinds of fields and the works that are really not good for our society. That is a discussion for another day. But anyway, the profession of accounting has not disappeared. In fact, it has grown significantly. But the job that accountants does has totally changed. You don't see people using the yellow spreadsheet pages anymore. You don't even see bookkeepers anymore. Bookkeepers has largely been replaced by computer programs. You got the Excel, you got the QuickBooks, and you got all those software that replace bookkeepers. So if you went to a trade school to look for bookkeeping, or you learn how to do punch cards, you do accounting, chances are you're already without a job. You will be retrained. But the profession stays. The profession moves on with the technology. So, in conclusion, can AI replace physicians? AI can, in my opinion, AI can perform many functions in signal processing and in data processing. It can do a lot more things in pathology and in radiology. But in knowledge processing, it can replace some tasks performed by today's physicians. It can do things with a large database with well-defined standards. It can replace the function of many life providers, such as nurse practitioners, that rely on algorithms, but it cannot replace the profession. Although doctors in the future will not be doing the same things that doctors do today, the same thing that doctors today are not doing the same things that doctors were doing 50 years ago. So that's my conclusion for this presentation. And I have a list of several other discussions that sort of talk about very similar concepts. And if you're interested, you can follow the links here. Dr. Yu has the presentation, and I have authorized him to share with you, and you can follow the links to find out what other people are talking about. Really, we're talking about very similar things. So that's the end of my presentation, and I will open up for discussion and questions.
Thank you very much. So now Q&A, question, comments are welcome. Any questions, comments? Well, okay, when you are thinking, so I do have some questions. I understand that AI can make mistake, and so now it's not really ready to perform at the level of an experienced human physician. However, to be fair, AI has a long history, but the recent explosion happened for just a few years. I mean, now, it's more mature than before, but still, this is under development. So it's a project in progress. And so I wonder, based on the current trend, the pace keep going. Well, recently OpenAI released ChatGPT, Strawberry, O1, and the improvement is really, really substantial. So based on this pace, and we cannot rule out that really in the near future, it may really reach the human level of expertise. And okay, still I don't mean, it will totally replace a human, but and I wonder whether now, in like in a training in med school and so on, and did you guys change the curriculum, to train future doctor, future nurse, future therapy to prepare for this change?
Now, I'm not a medical school faculty, so I cannot say for sure what medical school is changing its curriculum. Just a couple of observations. My daughter went through medical school about 10 years ago. And at that time, information technology was a very integrated part of the curriculum. When I was in medical school, learning anatomy is really because you are trying to learn 3D structures using in 2D projections. So you try to learn how a nerve goes and how an organ is positioned. Nowadays with AI or with information technology, you can see the picture on a screen and you can rotate. So it's much easier to learn about anatomy. You can also do a lot of practice using some dummies. So AI can significantly improve the training in terms of doing procedures. When we learn how to draw blood, we have to draw on each other. Now I think you can build much realistic models to allow students to practice using AI. So that's one thing I think AI can contribute really fast. In terms of improving, again, I think that those are into these three areas of technology: signal processing and knowledge processing. They are still more in line in the area of signal processing. You're trying to teach people how to process certain signals. They're not in knowledge processing. So knowledge processing is really, I think, that AI still has a long way to go. Like the legal thing, I haven't really talked about that. I see that no AI developer, my opinion is that no AI developer will be brave enough to stick their neck out and say, hey, I think this is the right diagnosis. That's just my personal opinion. So they always say maybe this, maybe that, and if you use ChatGPT or Copilot, they always have a disclaimer saying that we're not a doctor, go to a doctor. So, and frankly, personally, a list of all possible diagnoses are not very useful. I can do a Google. I think I can open it's faster. That's all. But most of the things I already know in my head. So it doesn't really like tells me. Maybe more useful if it can give me a probability. So I got ringing in 1 year. I'm from southern China. What are my probability of having cancer versus having an infection versus having some other things? That I think that from the system they can do that kind of calculation and give me some quantitative data. Be useful.
I see. Yeah. Okay, I have another question. I agree that perhaps we should not hand over the judgment, the diagnosis fully, to AI. Humans can, uh, can be better. But like after diagnosis, in the stage of implementation, and I heard that once in a while, in US, in Hong Kong, and so on, there are some human error, when the nurse or the physician did something, then they overlook some procedure, or simply they misread the number and the number, the label, and so on, and then end up a big lawsuit. So to my knowledge, in implementation, then machine tend to make fewer error than human being. Yeah, so I wonder, after the human perform diagnosis, it's better to let the machine to handle the detail in a more accurate and precise way to avoid lawsuit.
I agree. I agree that it's not AI per se, but it's information technology. IT can do a much better job in terms of like giving warnings and doing things. The classic example that I meant to write something about it, but I haven't had a chance to. You may or may not remember this case. It's a legal case. It is two doctors in Hong Kong being sued for manslaughter because it's a patient on it's a patient immunocompromised patient with kidney disease, and for some of the things the doctor just gave the patient. Sorry, it's a patient with hepatitis carrier, and the patient also got kidney disease. For some reason, the doctors failed to notice that the patient is a hepatitis carrier and gave the patient high dose steroid, which caused a flare of the hepatitis that ultimately killed the patient. Now, with a good AI system, the system should be able to cross-check that, hey, you're giving high dose steroid, the patient has hepatitis, and give a warning or stop them, saying that, hey, do you know that? Do you really have to give that high dose steroid? If you have to give it, can you do something about the hepatitis B or monitor it or give some antiviral? So these are things that that information technology are very, very useful. They're not necessarily AI per se. AI may be able to do this. Any IT can do that. In terms of the things you look for, they're not. If you look at a natural language system, you need to search a big database. You open any Dropbox, you open any, like on my cell phone, I have several drug programs. You open up the drug program, you look at steroid, it tells you what helpful, what to check. So it's very easy to build an algorithm to check that. Whether it's AI technology using the natural language processing technology or very traditional is then else. You can do that. When I was with Anthem, I did many demonstration projects to show that this can easily be done. You put in a medicine, the system should tell you that, hey, this is a contraindication. Don't do that. So it's either diagnosis and medication or medication or diagnosis, medication, contraindication. Now, yeah, the doctors should not miss that. I don't know why the system didn't talk up, saying that the patient has hepatitis B, is hepatitis B positive. When you give this, you should do that. Now, and I have a friend, sadly and gladly to say that with a hepatitis B carrier, he got lymphoma, he got chemo treatment. During chemo, they didn't recognize or they didn't realize that he got hepatitis B and he deactivated his hepatitis B. Fortunately, he survived. But again, that happened in a major top 10 academic medical center in the US. I don't want to name which one, but yes, AI or information technology can do that and definitely should do that. Definitely. But I don't want to say AI, I want to say IT. IT in healthcare are still amazingly, believe it or not, is 30 years behind the markets. I always make this joke. When I take my credit card, I went to Australia or New Zealand, I forgot. Put my ATM card into a random ATM machine. I took out maybe $50 or $100 Canadian, no, Australian or New Zealand the ceremony. The next moment, I went to my phone, I logged into my bank. I saw that the money is gone. How much equivalent to the US? In healthcare, when I was in practice, people came in with an insurance card. I try to find out whether the insurance is valid. It won't tell me. It said that we don't know. It was valid maybe 3 days ago. But during these 3 days, anything could happen. The patient could have changed insurance or changed doctor. Or they put this disclaimer, we don't know for sure, and you cannot guarantee payment. This information is not yet today. So a bank could do that 30, 40 years ago. The world, all the ATMs in the world are linked together into my bank account, and I can find out my today balance within fraction of a second. Why can't they even do it in terms of insurance coverage, eligibility? No excuse. I have actually some excuse. I know how IT departments in health plan works, which I don't want to bash them because I don't know who are watching this one, but just put it this way. Put it this way, okay? They're not. They're in another world. They're not in another world.
Okay, thank you. Okay, so you guys have any question, comment, feedback? Okay, if not, then yeah, then we'll end the meeting. And yeah, okay, I will forward the PowerPoint from Dr. Wong to you guys. Okay. Okay, thank you and have a nice evening to you. Have a nice afternoon to Hawaiian. Okay. Thank you. Thank you very much. Okay. Bye.
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 Thank you.
Thank you.